Welcome to Part 4 of the Patient and Family Advisor Orientation video series, Telling Your Story in a Healthcare Setting. In this video, we'll talk about the power of storytelling for building a bridge between patients and families and healthcare professionals. We'll also review 3 basic rules to remember when telling your story at a hospital event or meeting. Storytelling has always been a way for human beings to connect to one another and to learn about another person's experience. It's an especially powerful tool in healthcare because it helps to build a bridge between the people delivering the care, like doctors, nurses, and other professionals, and the people receiving the care, patients and their loved ones. You may have a story about being a patient or about caring for a loved one that can help healthcare professionals learn how to provide more compassionate care. You may not think your story is dramatic or exciting, but chances are you have a message that people can learn from. Even if you've done public speaking before, you'll need to take some time to prepare. You'll want to work closely with a staff member to make sure your story fits the time and the audience, and that it has a clear and effective message. Keep in mind that every good story has a beginning, a middle, and an end. Now let's look at 3 basic rules to remember when telling your story. Rule number 1 is to share something at the beginning of your story to win over the audience. People in the room need to know something about who you are before they can trust you. Sharing something personal helps them to understand more about you as a person. Now let's take a look at a couple of examples.
I've always prided myself on being an active part of my granddaughter's life. I stay with her after school, take her to dance practice, and she helps me in my garden. Now, all of that has changed.
I have a long and complicated medical history that includes high blood pressure, high cholesterol, diabetes, and 2 heart attacks.
Which of these introductions really draws listeners in and makes them want to learn more? You may want to pause the video here and discuss it with the group, or if you're watching it on your own, take a minute to write down your thoughts. You probably noticed that the storyteller in example 1 shared some personal details about herself that help the audience understand more about who she is as a person. She's a grandmother who helps to care for her granddaughter. Sharing this information makes the audience more curious about the rest of her story. The storyteller in example 2 gave us a list of diagnoses, which is not interesting or new information for an audience full of healthcare professionals. Storytelling rule number 2 is to use the middle of your story to share something that audience members don't already know. In other words, tell them what the experience was like for you, perhaps how you felt, or something meaningful that happened. This will give them a new perspective. Now let's take a look at some examples of this rule in action.
I stayed in the hospital for a week. They never answered my call bell. The food was always cold and it tasted bad, and people were rude. You need to get your priorities straight.
My healthcare team just made me feel like a person, like I'm more than just a diagnosis. They ask me about my children and my work. They really seem to care about me.
Which of these storytellers shared her experience in a way that people can learn from it? You may have noticed that the storyteller in example 1 listed off her complaints and didn't share anything that could help people improve. This way of sharing your experience is likely to make some people in the audience feel defensive. The storyteller in example 2, on the other hand, talked about specific things staff members had done to make her feel cared for as a person. This is something that many of the audience members probably haven't heard before. Rule number 3 is to give the audience something at the end of the story that they can take with them. Share a new insight, something positive you took away from your experience that might help them in their jobs caring for patients. In general, you should focus on experience and stay away from giving advice. Now let's take a look at rule number 3 in action.
So that's my story, and I hope you learned something from it.
It made me feel less scared when the doctors and nurses explained what they were going to do before they touched me. I hope you will remember that when you work with your patients today.
Which of these story endings includes a specific takeaway, something healthcare professionals can do to help patients in the future? You probably noticed that the storyteller in example 2 described one thing that the doctors and nurses did that helped her. This is something the audience members might remember as they work with other patients. The storyteller in example 1, on the other hand, didn't end with a takeaway at all. One last tip is to end your story with a message of thanks. Gratitude helps to build the bridge between healthcare patients and families and healthcare professionals, as we talked about earlier in this video. By following these basic rules and working closely with a staff member to shape your story to the audience, you can help others to learn from your experience. Sharing your story can be both healing for you and can make a difference for other patients and their loved ones. Thank you for everything you do.